Hello everyone. Welcome to See the Invisible, Living with an Invisible or Rare Disease. My name is Rhonda Franny Jefferson, and thank you so much for taking some time out to listen today. If you're new to this podcast, welcome, and thank you for giving this podcast a chance to hopefully spread some positivity and lend support to you. I do hope that this podcast can give a voice to all of those who have an illness, whether it be rare or invisible, as well as lend a voice to their caregivers. So today we are beginning our episodes on asthma. Our previous few episodes had been about allergies, and there are definitely some correlations between the two. I will also begin to touch on a subject that pertains not only to allergies, but to many aspects of healthcare and healthcare maintenance. As I can say in many of the episodes that I cover, while we may be reviewing a certain or specific topic, sometimes the thoughts, theories, and facts can pertain to many other illnesses. One of the things also I want to take a look at specifically is accessibility, and I'll go over a few aspects of that today as an introduction. I did email someone from one of the sources that I've used in this episode to see if she could provide some information about some of the stats that I found. I just emailed her yesterday though, so I know that is too early to hear back, but hopefully I will hear something before the end of the episodes. So overall, this first episode will give some basic information and things to look out for as we further discuss this topic. Now, before every episode and before we really get into the topic too deep, I do always like to say that I am in no way a medical, insurance, or legal expert. If you have any questions in those areas, please be sure that you contact a specialist in that field. I will discuss topics or articles that I found on publicly accessible means. Any opinion discussed is based on my experiences and my understanding of that particular topic and how it pertains to how people handle life and illnesses, including myself. It is not meant to be and should not be used in any place of medical advice. So first, let's define asthma. Asthma, according to one of the definitions that I found, is a respiratory condition marked by spasms in the bronchi of the lungs, causing difficulty in breathing. It usually results from an allergic reaction or other forms of hypersensitivity. So this is a definition that I found in one of my sources, and as usual, when I do use sources, they are copied and linked in the description of the podcast. So if you want to go in and read some more information about this topic or any topic on any of my other episodes, there are links in the description. So the definition I just provided is really a very basic one of asthma, and like with so many other different illnesses, there are different types and the exact symptoms can vary depending on those types and even person to person. Just hearing this description, we can already know that there are a number of different triggers and types just by the use of any other hypersensitivity in the definition. So as with so many different diseases, more than one factor can lead to the asthma, as well as to multiple treatment types or issues. So everyone's system is different. So let's look at some of the more common types of asthma. And actually, when I looked at different articles, some articles only had 6 listed, some had much more. So this is one of the articles that I found covered most of the information. So I wanted to use this as far as getting the terminology and what each type actually is. So allergic asthma is where someone has a reaction to something, and most of the time it's airborne, such as mold or pollen, and this can cause an asthma flare-up. Non-allergic asthma, just as the name entails, is an asthma flare-up that did not come from any type of allergic reaction. Then there's allergic bronchopulmonary mycosis. Right now, I am going to read directly a definition of this. It says, this is a pulmonary hypersensitivity disorder caused by allergy to fungal antigens that colonize the tracheobronchial tree. It usually occurs in atopic asthmatic individuals who are 20 to 40 years of age, or those with cystic fibrosis, in response to antigens of Aspergillus species. So this sounds like it's a very, very specific type, and in some ways, some of this makes sense. We may think of fungal antigens and not really think it's something that we can breathe in, but it can be, and that's where they can start to colonize or build up the tracheobronchial tree. One that I found interesting too was an aspirin-induced asthma, and it's also known as aspirin-exacerbated respiratory disease. With this one, it is triggered by aspirin, and the symptoms that many patients may have with this are nasal polyps, rhinitis, sneezing, a runny nose, and a history of aspirin sensitivity. And again, this is coming directly from one of the sources. So this will be interesting to explore, because I don't think many people, myself included, would think, okay, I'm taking an aspirin and that could lead to an asthma flare-up, but it can if you have that particular type of asthma. Then there's adult-onset asthma. So this is an asthma where it develops when you're an adult, and this is really important that the exact diagnosis is correct, that it is adult onset, to better understand the treatments, because this type can be more severe than those that are childhood asthma. There's asthma with fixed airflow obstruction, which I couldn't find a basic definition on that. When I looked, it would give either information to medicines to help with that, information on medicines to help asthma altogether. So, I will still continue to try to find more specific information on that. There's exercise-induced asthma. So basically, you have a type of physical exertion, and that brings on an asthma flare-up. Once that exertion is stopped, then the symptoms of the asthma flare-up start getting better. Another type that you may be hearing on commercials that you see on TV is called Eosinophilic Asthma. This does tend to be more severe. It's harder to control. And just to give a little bit more information on this, since it is something that, at least for myself, I see it on a number of different commercials. Going back to the adult onset asthma, this type does tend to come about when the person is an adult. Usually, this type of asthma does not respond to some of the traditional treatments, such as steroids. And that can be difficult. And again, it's very important to make sure the type of asthma is accurately diagnosed. This type, it does impact the whole respiratory tract system, and that system goes from the sinuses, the distial, the airways, and the lungs. And again, as with one of the other types of asthma, a lot of people who suffer from this have nasal polyps and chronic sinus problems as well. There's a cough variant asthma, where the cough is really the only symptom. So you get a coughing fit in and you're having trouble breathing. This is more likely to appear in children. And something to watch out for is the cough is not a wet cough, where, if someone has some type of respiratory infection and they're coughing, something may come up. With this type of asthma, it actually just is a dry cough and usually worsens at night. Work or occupational related asthma, that's when it's set off by something you're working with. Some examples could be smoke if you're working in some type of business or industry where you might be breathing in a lot of smoke, I would think maybe a restaurant, or also working around chemicals that, overall may be safe, but you have that sensitivity, so it will trigger an asthma attack. Nighttime asthma is one where it only occurs at night, and it does impact about 75% of patients. One of the interesting things I found on this is, it does affect about 75% of asthma patients. So, it's kind of thought or not understood by experts whether or not this is, one type of asthma that just worsens at night, or if it's actually a different subset of asthma altogether. This can really impact people because just with anything, if you're not getting a good night's sleep, then you're not really working at 100% the next day, whether you're at school or at work. If kids will miss more school, if you're an adult in the workplace, you may lose more time working. So it has a good impact, and when I say good, I mean a large impact on the quality of life. Then there's asthma with obesity, and so this would be asthma that's brought on because of the fact that you're obese. I admit I am obese. I do have trouble breathing. Some of the difficulty I have is usually when it's either with sinuses or if I am walking an extremely long distance. And these cover some of the main types of asthma. So like I said, I will touch on the different types throughout the upcoming episodes so that we can show the similarities and differences. When I did first start the episodes with allergies, I really thought asthma, which shows my own, lack of knowledge specifically about asthma, I thought it might be 1, possibly 2 episodes. So there really is a lot more to asthma. And to put it in perspective for, say, some other illnesses, there's usually something like a family of illnesses. And to use mine as an example, I have an autoinflammatory disease. And the thing is, there are other autoinflammatory diseases, but the treatments might be slightly different for one disease as compared to another, as well as the individual reaction to these diseases may vary as well. So, when I began, I just really thought of asthma as one type, possibly 2. But this really does help explain some questions that I've had. Like, I know some people who've had asthma that play sports, and going by what you see on TV, what you see on commercials, shows, whatever it may be, there's always been a picture of, say, someone who is in constant need of an inhaler or can't play sports, but there's different types of asthma, so it might be conducive for one person to play sports, and that won't have any negative impact. So it really just depends on the type you have and how you can control it. And now I want to take a look at some of the stats that are around asthma, as well as a few that I found very, very surprising, and I will definitely be touching base on these later. I really think this particular aspect deserves more than one episode, as it really crosses over from not just asthma, but to many different things, and I will be kind of discussing it in depth a little bit later in this episode, but really get into the meat and bones of it a little bit later. So to go through some of the stats, first, how common is asthma? For this portion of the episode, I will be relying a lot on some articles on the Asthma and Allergy Foundation of America's website. That's aaflikefrank.org. And they have a lot of information that I think is really good for people to take a look at. Again, crossing over not just with asthma and allergies, there might be, just some general information that is good to know, even if it's just for our understanding of how asthma can affect our communities. So the facts and figures are, right now there's no cure, but there's just treatment that in many cases will manage the asthma. Right now, there's more people with asthma in America than there ever has been. It's one of the most common illnesses, and I touched on it briefly too, that it can actually have a very large cost on those people who have asthma, but not just those individuals as well. It could have impacts to all parts of society. As an individual, if you're working or at school, you'll miss more time, you'll be less productive, and there's also cost aspects in regards to treatments. So just a lot goes into asthma being one of the most costly illnesses that there are. And so how many people have asthma? It's approximately 25 million Americans. So this is around 7 or 8%. And odds are, if you work in a small office, or, even a mid-size, so you'll probably find someone in there who has asthma. You may not know it because, again, the actual symptoms that they have may not be the traditional picture that you see on TV or movies, but they do have a form of asthma. Of those figures, about 20 million are adults, and it's actually more common in adult women than adult men, but it's more common in boys than girls. So that is definitely a very, odd kind of juxtaposition. So what this says to me is that as people grow up, you can quote unquote grow out of things. And it is possible to do that with asthma, but in some cases it does return. But it makes me wonder, is this because as boys grow, that they grow out of it, but not as many girls grow out of it, therefore flip-flopping those figures? My husband actually had asthma and was treated for it for a long time as a child, but he doesn't have it now. So, he definitely grew out of it. Looking specifically at children, this is a 2019 figure. Coming directly from the AAFA website, 44.3% of children age 18 and younger who had asthma reporting having more than one attack in the last year. About 47.2% of the children under the age of 5 had at least one episode. But according to the CDC, the actual individual episodes in children have declined between the years of 2001 and 2016. Now, the cost in regards to visits to the doctor, the ER, it's using a 2016 figure for this first one, is in 2016 there were about 9.8 million doctor's visits for asthma. In 2018, asthma actually accounted for, and I'm going to quote directly from the statistic, 178,530 discharges from hospital inpatient care and 1.6 million emergency department visits. Now, this next stat is one of the ones that I do want to get into more detail later, but African Americans are 5 times more likely than white Americans to visit the ER due to asthma. And that says to me is the accessibility issue. So that's one of the topics I want to at least start discussing before this episode ends, because just reading some of these figures, they're staggering. And, I feel, just personal feelings here, just my opinion, that we are in a position, far better than we've ever been in any other time in history. And that's to be expected because as, time moves on, of course, there's, more treatments, more resources, more research. All of those come together to try to build a better life for everyone. And so to see that disproportionate number, it's something that, we can't just say the number and not look at it and what it actually means. So, it's something that has to be addressed because, medical treatment, you shouldn't have to struggle for medical treatment. There shouldn't be a reason why someone has to take different routes to try to get treatment. So, again, we will look at the accessibility issues later on, just so we have a better understanding, because if we don't have an understanding, then how are we going to address it? The next stats are on how many people die from asthma. On average, and this is a number from 2019, on average, 10 Americans die from asthma each day. That's over 3,500 people in 2019. And most of those deaths could have been avoided if there was proper treatment available. So, I know with any illness, there is a point where maybe there's not a treatment that we have available now, or there's an episode that happened so quick that, maybe it wasn't able to be addressed. But, to have figures where if there was just proper treatment, if there was just access to things people needed, that those numbers would drop. One death that could be prevented by any of, access to any of that is one death too many. Within these numbers, adults are more likely to die from asthma than children, and women are more likely than men, but proportionately, or disproportionately, I should say, in reversing the orders, boys are more likely to die than girls. So, children as compared to adults. And also, African Americans are around 3 times more likely to die from asthma than Caucasians. And again, that goes back to what I was just saying a moment ago. The costs of asthma estimated between 2008 and 2013 was more than $81.9 billion. That includes any type of medical cost. And as I mentioned before, there's usually days that the adult has to take off. That's either for their own asthma or if they're taking off for their children because they're having a flare-up, and then also school days missed. And to break that down, it's about $50 billion in medical cost, $29 billion due to the mortality with asthma, and $3 billion in losses due to missed work and school days. Now, there is a chart that I'm going to post a link to that starts to discuss the disparities of asthma treatments in America. And that's what we're going to talk about, within this episode arc. And again, hopefully I can hear back from someone within this foundation so that we can have a discussion and look at that a little bit more, because the numbers are just, extremely disproportionate. And this article on the AAFA website gets into a little bit more detail, shows some charts that definitely provide a lot of information. And again, it's something that is going to take more than one episode, but it's important to take a look at this and see how these disparities affect not only people in regards to asthma, but with many different aspects of healthcare treatment. Playing a part in some of the access to asthma care is location. And location really has such a big impact, not only on treatment, but whether or not you actually get asthma. So what I found is there's actually something called asthma belts. There's 2 that are primarily in the U.S. with some more locations or areas, regions have started to pop up with more asthma cases. So just where I live in the Mid-Atlantic in Delaware, and that is actually one of the 2 main belts. It's called the Northeast Mid-Atlantic Asthma Belt, And it runs from Massachusetts down to North Carolina, so Delaware is firmly in the middle of that. My mom used to say things like, oh, you live in Delaware, you have allergies. And as we know that allergies and asthma can sometimes go together, we are right in the middle of that whole area that encompasses the Northeast Mid-Atlantic asthma belt. Now, as far as cities with most impact of asthma, this region itself has 10 of those 20 cities. So it has kind of a firm reign on being the biggest asthma belt in the U.S. And going back to the AAFA website, I'm going to quote something directly from there, that as far as why these locations particularly have higher asthma rates, it is because of more industry or the industrial work that's done in that area, more pollutants in the area. So what they said is the higher rates are likely due to more industrial and urban populations. Asthma rates tend to be higher, especially among children in urban locations, end quote. So just looking at Delaware, though, it's kind of interesting, which maybe it's because of, airflows and everything, but as far as accessibility and being able to get treatment in certain areas, living in a more urban area when I lived in a different part of the state, I definitely had more access to some of the doctors I needed to see. That's at least as far as location. Now that I'm living in an area that's less urban, less industrialized, to see an allergist, I have to make decisions on where I want to go. Like the only allergist that covers the things that I need. So there are some other allergists out there, but the ones that would suit my needs, it's the same allergist and he has 2 different offices. So it's like a matter of trying to figure out what's the easiest to get to. Will I have to get a babysitter and go to either a different state, which sometimes it's a little easier to get into that office, or if I go to the one that's a little bit closer, will it take me longer to get into seeing them? So that's just one aspect of accessibility, though. And even though I'm saying down here I don't have the accessibility because of the location, other factors can layer onto that. So I'll talk about that in a minute. Allentown is actually considered like the asthma capital right now. It is in Pennsylvania, and as soon as I saw the name, I just started singing Billy Joel's Allentown. If you're not familiar with this song, it's really describing a city, and the livelihoods of many people have just gone away. The factories have closed. There used to be coal mining in the area, and all the coal is gone. So now everybody in the town is dealing with their loss of jobs. There's high impact to the community. So in this town, you have an industrialized region. So you have pollutants in the air. But now people have lost their jobs and, they're trying to get by. Maybe they only have one vehicle now. Maybe they can't take off the work from the job that they do have to either go to the doctor for themselves or for their children. Maybe they don't have access to health care because they don't have the job that provides health care. And even if, say, they get insurance through the Affordable Care Act, a lot of times those have high deductibles. So there's so many different factors for this one town, and this is just one town, but so many towns and cities throughout the country experience the same thing. The next asthma belt is Ohio Valley, and they have 6 of the top 20. Some of the cities that are included in this are Cleveland, Dayton, Columbus, all in Ohio, then Detroit and Louisville, Kentucky. Those are some of the cities that appear in this belt. And, again, looking at some of these cities, they are highly industrialized. So as a result, there's air pollution, and looking at some of those locations as industries have started to fade, then there's more poverty. There's a lack of access to jobs in the area, and again, that all plays into whether or not you're getting the proper treatment. Now, there's actually 2 cities that are in the top 20 that are in the West. Leading up or counting all these up, there's only 18, so there's a couple other cities sprinkled in there. But relatively new to the whole asthma discussion is the West. And the 2 cities are Tucson, Arizona at number 10 and Fresno, California at 19. And this surprised me a little bit, because I used to hear, if you ever watch an old show or read something about history, it may say that someone moved to Arizona because the climate was better for their breathing. They're having some type of respiratory issue. But now Tucson in Arizona is actually one of the top cities on where asthma has impacted them. Now, something that my history teacher in high school kind of taught is, if you look at a map and the progression of migration, it's usually heading west. So, looking at the U.S., just only the U.S., the first area that was settled was the east. That's where people were coming from. They were coming from the east, so that's where they landed. And so, of course, the eastern part of the country, or the mid-Atlantic, where it has the most number of cities, they were industrialized probably earlier than some of the other cities because they hadn't grown as much. There was more human impact, and while there were the indigenous people of North America, as people did migrate to the United States, it was the East that was impacted first by a large influx of people. That part of the country started to be impacted more by the human footprint, where then, as more and more people did migrate to the U.S., the expansion moved westward. So that's where you have the Ohio Valley. Now you're getting to the west. And now there's a lot more industrialization over there. So the impact of industrialization and the pollutants and everything that's impacting the air, it's leading to more and more people having asthma around those locations. Before I end this episode for the day, I do just want to briefly give some information about what accessibility means, because throughout this episode arc, I will be discussing accessibility, because seeing these numbers, it's really showing how some people, even within the U.S., do not have access to the treatments that they need. So, when people think of accessibility, there might be different things that come to each individual's mind. When I was in college, I had a friend who was from California. I went to college in New York. When you would ask her what the main difference was between East Coast, West Coast, she would say, East Coast, everybody walks. West Coast, nobody walks. So what she was saying is that on the East Coast, there's, you have subways, you have more mass transit than you may have in, say, LA. I think we've all seen pictures of the overpasses, the freeways. They're always jam-packed. And while they do have, of course, mass transit, it is a city or area that widely depends on the use of individual vehicles. You go to New York City, it costs a lot to even just park. So you have different ways to get around just from the different coasts. But of course, I mentioned where I live, even though it's East Coast, there's not a lot of public transportation. You go to another part of the state, there is. So what I'm getting at is accessibility to one person could have an entirely different meaning to another. So you may have found a specialist. You may be able to make a payment arrangement or your insurance covers this specialist completely. But if they're 5 hours away and you don't have an individual, personal vehicle, you're not going to get to that specialist. And I'm not exaggerating by saying 5 hours away. Sometimes there are, certain aspects of an illness where you have to travel to see a specialist. So those types of things come into play. You have, even when you have insurance, is there a deductible? How big is that deductible? Is there co-insurance, which is an amount or percentage that you pay? A lot of times you have plans that have high deductibles, and then you still have co-insurance that you need to pay afterwards until you meet a certain point. Again, transportation, ability to get into the doctor, and babysitting. I mentioned before, if I have something, some types of doctor's appointments, I need to get a babysitter. So am I going to be able to get family who can watch them and not charge me anything, or will I have to pay for a babysitter? There's just, like I said, so many different aspects to accessibility that I probably would not be able to go through every single one of them. And I wanted to bring this up first because as we go through more of the different types of asthma and some of the numbers, we can start to see that, yes, accessibility is a big issue. And it's not just what one person may think of as accessibility, because one person may have access to really great insurance, but because of where they live, there's no specialist in that area. Or, again, insurance may pay for the visit, but you live in an area where you may take mass transit everywhere, and that would make it a hardship to get to this specialist. Also, things that are not necessarily covered by insurance, such as humidifier. The cost of the inhaler, I know even with my insurance, it can sometimes be very, very expensive. And when I saw my pulmonologist last, she was like, even, if you don't need a refill right now, I'll send it in. And that way too, when I hit my deductible, I still had hit my co-insurance where the cost was either very low or nothing. I got that refill because I knew I would need it, and I had to think ahead on how I was going to be able to purchase it. So these are just some food for thought items that I think are important to keep in mind as we're going through the numbers, because as I said with as I've said on previous episodes, everybody's situation is different. So I want us to be able to look at the idea of accessibility not through just our individual lens and how it affects us, but how it may impact other people, and how we need to find a way to voice these concerns so that those areas of accessibility, or lack of accessibility, I should say, are addressed. So I'm going to end my first episode of the asthma asthma episodes right here. And we'll start looking a little bit more at the individual types, just to give you an idea of where we'll be going. With this, I am going to try to get information about schools and inhalers, because I know I've read, at least up to a few years ago, that some schools would not allow children to have their emergency inhaler at their desk with them. It says that in the name, because it can be an emergency inhaler. You need it right there. And if you've listened to my allergy episodes, I did mention too about sometimes with school children the accessibility of their EpiPens, which all of that goes into access due to cost right there. So those are just a few things we'll be taking a look at. And hopefully, like I said, I'll hear back from the AAFA email that I sent to try to get an idea of what might be going on, or how we're working towards making sure there aren't these disparities within treatment. Okay, so I do want to thank you for taking some time out to listen. This actually ran a little bit further or a little bit longer than I anticipated, but there were some things I really wanted to cover within the first episode so that we had a good solid base. I also do just want to apologize for the last couple of weeks. I did not put out an episode last week. I was not feeling well, and my father is also in the hospital. It's pretty serious. So, there are things I've been trying to take care of for him, and my whole family has, been trying to take care of things for him. And, with COVID too, there's limited visitation. There's more visitation than there was, say, 3 weeks ago, but still it's only the same 2 people that can go see him. And I have 8 siblings. There's 9 of us. So that's kind of a number that you have to try to narrow down. So, it's just been a little rough as far as that goes. So I will try to put out an episode each week. But if for some reason it doesn't come out on time or it comes out the following week, please be patient with me. I'm trying to do my best as far as getting the episodes out. And I do think this is an especially important time of year to cover things like asthma and allergies, because at least for me, this is a time period where those things start to flare up for me. So my contact information will be in the description box. I do have a website, my email's down there, my Twitter, my Facebook. So if you want to reach out with any suggestions and topics or ideas, please feel free to. And I just hope that everybody has a great rest of the week, and I will talk to you again soon. Bye.